Hello guys, in this class, let's now talk about the blood supply. Now when we talk about the blood supply to the lower limb, we're talking about both the arterial supply and the venous drainage. Please take note about that. So we're going to talk about the arteries and we're going to talk about the vein. This will be our lesson 7. So we said that when we talk about blood supply, the blood supply consists of 1, we talk about your arteries, and 2, we talk about your veins. So both arteries and vein form what we call the blood supply. Now, if you say you understand that, let's now trace the blood supply. How does blood first get to the lower limb? Let's trace from the heart. Now, this is the heart. The heart releases what we call the ascending aorta, which supply blood. So this is the ascending aorta. You can see, first of all, we said this is the heart. From the heart, we have the ascending aorta. From the ascending aorta, this part is called the arch of aorta. Call it the arch of aorta. And the arch of aorta has 3 branches here, which is called the BCS, the BCS. This B is called your brachiocephalic artery. Now, it gives 2 branches, brachium and cephalic. So it gives 1 branch going to the right arm, right, which is the right subclavian artery, and the one going to the head, which is called the right carotid artery. So this is what we call that. This will give rise to 2. Now, this one here is called the left carotid artery. While this one, we give the blood supply to the left arm. So this is called the left subclavian. Do you understand that? Only this has 2. That's why it's called your brachiocephalic. It has right subclavian artery and the right carotid artery. This one has the left subclavian the left carotid artery, while this have the left subclavian. So it's going to give an arch, and the artery is going to continue to descend down. It's now going to be called the descending aorta. Now you keep descending down. At the diaphragm, is going to change them from becoming the descending aorta to become the abdominal aorta. So this becomes the diaphragm. At the diaphragm, from the diaphragm, we're already leaving the thorax, and we're entering into the abdomen. So it now becomes the abdominal aorta. Everybody look at it. We said that the heart blood starts from the heart, and it moves to become the ascending aorta. From the ascending aorta, we said it's called the arch of aorta, which is going to give rise to 3 branches going upward. The BCS going to the 2. The right and the left arm, and going to the brain. At the diaphragm, is going to change them from becoming the descending aorta to become the abdominal aorta. Do you understand that? If you say you understand that, take note that at the level of lumbar 4, that's L4 vertebrae, which is a major landmark. At the level of the L4 vertebrae, the abdominal aorta is going to split into 2. Now look at it. At the level of look at it, the L4. At the L4 vertebrae, the abdominal aorta is going to split into 2 to give what we call the common iliac artery. But there are 2 now. So this one will be called the right common iliac artery. What is one will be called the left common iliac artery. So we have the right common iliac artery and the left common iliac artery. But from the name, of course, you should know that one is going to the right leg and the other is going to the left leg. Do you understand? So this is actually how blood goes to the lower limb. Starting from the heart, goes to the ascending aorta, from the ascending aorta to the arch of aorta, from the arch of aorta to the descending aorta, from the descending aorta to the abdominal aorta. From the abdominal aorta, the level of the lumbar 4 vertebrae is going to bifurcate into 2 to give rise to the common iliac artery. We have the right common iliac artery and the left common iliac artery. Do you understand? Now let's also see another diagram to look at this. Now, if you from this diagram, you can see that this is the ascending aorta. This is the transverse arch, which we call the BCS, right? The brachiocephalic carotid and the left subclavian. And it now descending is called the descending aorta. It passes through the diaphragm. This is the diaphragm. You can see to become the abdominal aorta. And at the level of lumbar 4, you can see it's bifurcating into 2 to give rise to the right subclavian artery and the left subclavian artery. Do you understand? Now let's continue our journey down. Now, from here now, we already established this is the descending aorta. We know how we got to this descending aorta, right? We said that immediately it passes through the diaphragm, which is a dome shape, it becomes a abdominal aorta. And we now say that the level of the 4th lumbar vertebrae is going to become the common iliac artery, which is the right common iliac artery and the left common iliac artery. But something is going to happen here. Take note that the common iliac artery, whether right or left, is going to give a branch. That branch will be called your internal iliac artery. Look at it. This is the internal iliac artery. So if this becomes the internal iliac artery, that means this part that is left is now called the external iliac artery. So we can boldly say that the common iliac artery is going to bifurcate into 2. The one that is going to run inward is called the internal iliac artery, while the one that is going to run outward is called the external iliac artery. Please, this is very important because it is this internal iliac artery that is going to supply your gluteal region, your your pelvis, your perineum. Perineum, talking about your male and your female what's-ups. Do you understand? So what is going to supply the gluteal region is the internal iliac artery, but the external iliac artery will continue its journey to the leg. Do you understand? We said the common iliac artery is going to divide into two, or it's happening on both legs, on both legs. The internal iliac artery and the external iliac artery. We said the internal iliac artery will supply the this is the pelvic region, so the gluteal region and everything. Why the external iliac artery will continue towards its journey. Now look at it. This external iliac artery keep moving and it's going to enter the leg. This landmark, this point is what we call the inguinal ligament. What do we call it? Inguinal ligament. Of course, by now you should know that. So this is what we call the inguinal. Inguinal ligament. So immediately it passes through the inguinal ligament. Guess what? It stopped becoming the external iliac artery and it now starts new name to become the femoral artery. So at what point does the external iliac artery become femoral artery? Immediately it passes through the inguinal ligament. Everybody, at what point does the femoral artery, does the external iliac artery become the femoral artery? Immediately it passes through the inguinal ligament. Of course, if it passes through the inguinal ligament, it has entered the lower limb, that's the leg proper. Do you understand? So this is what we call the blood supply of the lower limb. Constant past question here. At what point does the femoral artery become, at what point does the external iliac artery become the femoral artery? We said was at the inguinal ligament. Now if you say you understand, now let's continue the journey. Now everybody, all eyes on the diagram. First, we said this is the external iliac artery. At the inguinal ligament, the external iliac artery becomes the word. So let's call this, let's do this arrow. It becomes the word, the femoral artery. So this is 1, let's call this 2. So immediately it passes through the inguinal ligament. Immediately it passes through the inguinal ligament, it becomes the femoral artery. Are you seeing that? And it's now at the femoral artery is now lying in the thigh. Now, as it runs down within the thigh, it's going to give a deep branch. That branch is what we call the profundi femoral artery. Look at it, everybody. After the external iliac artery, it passes through the inguinal ligament, becomes the femoral artery. Now, it now starts to run down. We now said within the thigh, is going to give a deep branch. That deep branch, the word deep in Greek is called profundi, so it is called the deep femoral artery. And the deep femoral artery has 3 branches. 1 is what we call the lateral circumference femoral artery. 2 is what we call the medial circumference femoral artery. And 3 is what we call the perforating artery. Everybody, look at it. We said that the external iliac artery, after the inguinal ligament, becomes the femoral artery. The femoral artery in the thigh is going to give a deep branch. That deep branch is called your profundi femoral artery. Look at it, profundi femoral artery. The profundi femoral artery is going to release 3 branches. I call them the LMP. Look at it, LMP. The lateral circumference femoral artery, the medial circumference femoral artery, and the perforating artery. LMP. Lateral circumference femoral artery, the medial circumference femoral artery, and the perforating artery. Now it's not still going to continue. The femoral artery is still going to continue the journey down. At this point is called your adductus magnus. At the adductor magnus. At the adductor magnus, also called the adductus hiatus. So let's call it. The adductor magnus is a muscle. It forms a hole called the adductus hiatus. So we can also say the adductus hiatus. Look at it, it's a landmark also. Take note at the adductus hiatus. The adductor, look at it, we said the femoral artery is going to keep running down. And when it gets to this point, which is a muscle, that muscle is called the adductor magnus. You know the adductor magnus, right? It is the lateral compartment muscle of the medial compartment muscle of the thigh. Now, at the adductor magnus is going to form a hole. The adductor magnus to form a hole. That hole is called your adductus hiatus. From the immediately you get to that adductus hiatus, it stopped becoming the femoral artery to become the popliteal artery. Everybody, at what point does it become the popliteal artery? The femoral artery become popliteal artery at what point? The adductor magnus, or you say the adductor hiatus. The adductor magnus is a muscle. That muscle form a ring or a hole shape. That hole is called the adductus hiatus. Hiatus, the word hiatus is like a hole. Do you understand? So it now becomes the popliteal artery. Are you seeing that? This popliteal artery is now going to keep running down. When the popliteal artery run down at the end of the tibia, look at the end of the fibula, look at it, correspond to the word fibula. So head of fibula, all this landmark are MCQ question. So head of that fibula head, or you say at the lower end of popliteal muscle. At the lower end of popliteal muscle, the popliteal artery is going to bifurcate into two. One is what we call the anterior tibial artery and the posterior tibial artery. Are you seeing that? The anterior artery is going to bifurcate into two to give the word the anterior tibial artery and the posterior word tibial artery. Look at it, everybody, all eyes on the diagram. This is the anterior tibial artery, this is the posterior tibial artery. Are you with me? Everybody, look at it. We now look at it. We start from again. We say the external iliac artery passes through the inguinal ligament, becomes the femoral artery. The femoral artery at the time we give 3 branches. That branches is give first is called the profunda femoral, which is the deep branches. The deep branches release 3 LMP, the lateral circumflex femoral artery, the medial circumflex femoral artery, and the perforating artery. The femoral artery is going to continue the journey. At the adductus aortus or the adductor magnus, it becomes the popliteal artery. The popliteal artery at the fibular head or the popliteal muscle, lower part of the popliteal muscle. This is lower part of the popliteal muscle. It now bifurcates into two to give the anterior tibial artery and the posterior tibial artery. You can see that the posterior tibial artery is now going to bifurcate to give another artery called the peroneal. The word peroneal is also called fibula. So anytime you see peroneal nerve, we're also talking about fibular nerve. Remember that the leg has 3 compartments. So the anterior tibial artery will supply the anterior compartment of the leg. The posterior tibial artery will supply the posterior compartment of the leg, while the fibular artery or the peroneal artery will supply the lateral part of the leg. The leg has 3 components divided by the crural fascia. We talked about this. So you can see, and this is the anterior tibial, this is the posterior tibial artery. So the anterior tibial artery is going to continue down. Immediately get to the to the malleoli. Immediately get to the malleoli. Malleoli is going to become the dorsal pedis artery. Now, either we say malleoli because it's a constant question they ask whether is the retinaculum. I'm going to show you. Do you understand? But first of all, master this. Have this enter your head. Why? The posterior tibial artery, 2 at the malleoli, is going to divide into 2 to give rise to what we call the lateral and the medial plantar artery. That is for the leg. We're not in the leg now. So let's just focus here. Do you understand the landmark? Everybody follow me. We said the external iliac artery, immediately it passes through the inguinal ligament. What does it become? It becomes the femoral artery. The femoral artery is going to run down. At the time, it's going to give a deep artery called the profunda femoral artery. Look at it, profunda femoral artery. The profunda femoral artery is going to release 3 branches, LMP. The lateral circumflex femoral artery, the medial circumflex femoral artery, and the perforating artery. The femoral artery is still going to run down. Immediately it gets to the adductus aortus or the adductor magnus. It changes name from femoral artery to become the popliteal artery. Are you seeing that? The popliteal artery will keep running down. Immediately it gets to this point. What do we call that point? We said that point is this arrow here. The fibular head or the left popliteal muscle. At the tibial head or the left popliteal muscle is going to bifurcate into 2 to give the anterior tibial artery and the posterior tibial artery. The posterior tibial artery, the anterior tibial artery will blood supply the anterior compartment of the leg. The posterior tibial artery will blood supply the posterior compartment of the leg. This posterior tibial artery is going to divide and give a branch. That branch will be called the peroneal artery. It's giving a branch. Peroneal artery. What peroneal means? What? Fibula. So if you see peroneal nerve, they are talking about fibular nerve. Peroneal artery, fibular artery. So it's going to give you what? A fibular artery. Are you seeing that? Which will the blood supply the lateral compartment of the leg. We now said the anterior tibial artery is going to continue. Immediately get to the malleoli, it's going to become the dorsal pedis artery. Are you seeing that? The word dorsal means the dorsum of the, it's going to supply the dorsum of the foot. Pedis means leg. So dorsal pedis artery. So it's going to supply the anterior, that's the dorsum of the foot. The dorsum of the foot is called the anterior part of the foot, right? Why? The posterior tibial artery is going to run as well as the malleoli is going to divide into 2, which is the lateral plantar and the medial plantar what artery. We're going to talk about that in the football. Do you understand? Look at this diagram. I want you to look at this diagram. This major thing I want you to see first. This is the anterior tibial artery. Most of the times we said that at the malleoli, or you say at the ankle joint, the anterior tibial artery becomes the dorsal pedis artery. But most times you may not see ankle joint. You may not see malleoli. Another thing they can ask you is that this is what we call the superior extensor retinaculum. This is the inferior flexor retinaculum. So we have the superior, we have the inferior. Look at the anterior tibial artery, this red one. As it keeps coming, immediately it passes through the superior extensor retinaculum, passes through the inferior extensor retinaculum. At this point, it changes its name to become the dorsal pedis artery. So another example question they can ask is that at what point did the anterior tibial artery become the dorsal pedis artery? I'm giving you 3 landmarks. The first landmark is that we talk about the malleoli. 2, we talk about the ankle joint. If you not see the ankle joint, tell them that after the inferior extensor retinaculum, that's after the inferior extensor retinaculum. Inferior extensor retinaculum. After the inferior extensor retinaculum, look at it. Maybe this is the extensor retinaculum. This is inferior border. It now becomes the dorsal pedis artery. I know I'm telling you that because it's a constant past question. Do you understand that? If you say you understand that now, let's now still recap the blood supply of the lower limb. We said that the blood supply of the lower limb, now we've taken the diagram, let's now take the notes. So the blood supply of the lower limb is from the femoral artery and its branches. And where the femoral artery coming from? External iliac artery. So external iliac artery. And 2, the internal iliac artery. Remember the external iliac artery, both of them form together to give rise to the what? To the common iliac artery. So we said that the blood supply is from the femoral artery, by bracket we will call it the external iliac artery, and the internal iliac artery. Let's now focus on the external iliac artery. What are the branches of the external iliac artery? The first is what we call the femoral artery. So the femoral artery begins at the midpoint of the inguinal ligament. Midpoint. Now let me draw that diagram for you. Look at it. Let's say I do like this, and I do like this, and I do like this. This is the inguinal ligament. This is the leg. Now this midpoint. So we said that the femoral artery begins at the midpoint of the inguinal ligament. Midpoint of the. So we are taking this point to be the midpoint of the inguinal ligament as the continuation of the external iliac artery. At this point, it is the external iliac artery, but when you get to this point, it becomes the femoral artery. So the femoral artery begins at the midpoint of the inguinal ligament at the continuation of the external iliac artery. We said it enters the front of the thigh and quickly gives a branch. That branch is called the deep femoral branch, or you call it the profunda femoral branch. So the deep femoral artery or the profunda femoral artery, which this deep profunda femoral artery or the deep femoral artery is going to give out 3 structures. I call them the LMP. What are the 3 branches? We said the lateral circumflex femoral artery, the medial circumflex femoral artery, and the perforating artery. What is my acronym? LMP. LMP. Those are the branches of the deep femoral artery, or also call it the profunda femoral artery. Now the next is what we call the popliteal artery. First of all, how is the popliteal artery formed? The popliteal artery is a distal continuation of the femoral artery. And we said, what was the landmark? At what point does the femoral artery become the popliteal artery? We said that at the point of the adductors magnus. Bracket open, we say it is the hiatus. And the adductors magnus, bracket open, the hiatus, it becomes the popliteal artery. So the popliteal artery is a continuation of the femoral artery in the popliteal fossa. We said that the popliteal artery descends down through the popliteal fossa at the head of the fibula. Is going to divide into what are the 2 parts, the anterior tibial artery and the posterior tibial artery. At what point does the popliteal artery divide? We said that either at the lower end of the popliteal muscle, or you say the head of the fibula is going to divide into 2, anterior tibial artery and the posterior tibial artery. Now let's now talk about the anterior tibial artery. The anterior tibial artery supplies the anterior compartment of the leg, and it's going to continue its journey to the foot to become the dorsal pedis artery, right? We said it's going to continue its journey in the foot to become the dorsal pedis artery. I ask you at what point, I gave you two statements there. At what point does it become dorsal pedis artery? Number one, we say at the malleoli, or we say at the ankle joint, or we said after the what? The inferior extensor what? Retinaculum. I take that again. At the malleoli, or you say at the ankle joint, or you say after the what? The inferior extensor what? Retinaculum. Now look at it. The next now what to call it. After that point, it now become the what? The dorsal pedis artery. The dorsal pedis artery will supply the word the dosum of the foot from the word dorsal pedis, dosum of the word of the foot. Do you understand? If you don't understand the blood supply, pause it and watch it over again, because it has a lot of past questions and it gives you an overview of how the overview of the blood supply. Now, since you have understand the anterior tibial artery, now what about the posterior tibial artery? Don't forget that we said that the popliteal artery is going to divide into two to give the anterior tibia and the posterior tibia. Now, the anterior tibia will later become the dorsal pedis artery. The posterior tibia is going to give a branch. That branch is called your peroneal artery, your fibular artery, which will innervate or blood supply the lateral compartment of the of the leg. Are you with me? Why the posterior tibial artery too is going to continue its journey, is going to supply the posterior compartment of the leg, and is going to continue its journey until you get to the to the myeloli or the myelolus of the ankle joint. What happens is going to split to give the lateral plantar artery and the medial plantar artery. So let's look at that. The posterior tibial artery, which is the posterior compartment of the leg, it supplies the posterior compartment of the leg. At the ankle, behind the medial myelolus is going to divide into the medial and the lateral plantar artery. It's going to divide into the medial and the lateral plantar artery. We explained that from that diagram we gave. Now, the medial and lateral plantar artery, what's the function of the medial and lateral plantar artery? They are branches of the posterior tibial artery and they supply the sole of the foot. So who is supplying the dorsum of the foot? Dorsal pedis artery. Who is supplying the plantar of the foot? It is called the medial and the lateral plantar artery. Where is the medial and lateral plantar artery coming from? Posterior tibial artery. Where is the dorsal pedis artery coming from? Anterior tibial artery. Do you understand? This is what we call the blood supply of the lower limb. What blood supply we talk about? We have talked about the artery. Now, what's now the applied anatomy? Take note that it is sites for arterial pulse. You can feel arterial pulse from the blood supply. What are the arterial pulse you can feel? Number one, femoral pulse. Femoral pulse can be felt at the mid-inguinal point. We'll talk about that, right? Look at it. We said this point is called the mid-inguinal point. This is the inguinal ligament. So we can feel femoral pulse. We can also feel popliteal pulse at the popliteal fossa. In the popliteal fossa, we can feel popliteal pulse. Number three, we can also feel the posterior tibial pulse. Where can now you find the posterior tibial pulse is where the posterior tibial artery bifurcates, and we say it's medial myelolus. And we can also feel the dorsal pedis pulse. Of course, where it's innervating dorsum of the foot. So at the dorsum of the foot. Don't forget, constant past question is this one. Where do you feel the femoral pulse? Mid-inguinal point. Mid-inguinal point. Where do you feel the popliteal pulse? Feel the popliteal pulse at the popliteal fossa. We talk about the diamond depression at the posterior aspect of the knee joint. Where do we feel the posterior tibial artery? Where is the posterior tibial pulse? The posterior tibial pulse is where the posterior tibia is going to bifurcate, because it's going to bifurcate to the lateral plantar and the medial plantar, which will blood supply the sole of the foot. So that point in bifurcate is called the medial myelolus. I'll talk about the dorsal pedis artery pulse. Do you understand that? If you say you understand that this is pulse fixation, you can see you are trying to feel the pulse, and that this point is what we call the medial myelolus. Are you seeing that?